Okay, guys, this is Dr. Jesse Morse of the Florida Orthopedic Specialists in Stuart, Florida, as well as the Fantasy Doctors, and we're going to talk about the Cincinnati Bengals A.J. Green today, stud wide receiver. Less than a week ago, he scored 3 touchdowns. And now he is already banged up with a groin injury. Now, he said it at the end of the game that it was mild. But here's the thing with groin injuries. They are very painful. It's very challenging to really do anything with that leg. We're talking lifting the leg, rotating the leg, kicking out. It's a constant nagging, throbbing, annoying pain. And it's usually intermedial proximal thigh, sometimes radiating all the way up to the groin, way up to the groin. So these can be very painful, very challenging to function even normal daily life on, never mind trying to be a professional athlete and run, cut, and jump and everything. So depending on how severe this strain is, he may be able to go this week, but I'm a little skeptical, and I personally won't be playing him because of that. Usually these take a good 2 to 3 weeks to calm down. Rehab, anti-inflammatories, there's not much you can do. You can consider PRP. I don't know what the data shows for that, but for the most part, this is just a time thing. And Boyd looked fantastic as a replacement for him. I don't know if he'll be able to repeat that again, but he looked very good, and Gio did quite well for Mixon as well. So they have other options with Eifert and Croft and a couple other guys. So I know they'll miss A.J. Green if he doesn't play. If he does, he'll be limited at best. But I expect him to be maybe 70% in about 2 to 3 weeks from now, so you still won't be 100%. And another thing of note is these re-injure really easily. So what can happen is you feel like you're better, you get it back to 70%, and then you re-injure it and it goes back to 40%. And now you're talking about even more injury. Maybe you even went from a grade 1 to a grade 2 after the re-injury, so now you're out 4 to 6 weeks or something. So these are very annoying injuries, like calf injuries, and to an extent like hamstring injuries. So you have to be careful here. If I was the Bengals, I would personally have him sit this week, even if he's feeling quite good, because he's important to your franchise, and they actually look pretty good this year. So that's all I got for you. This is Dr. Jesse Morse of the Fantasy Doctors, and we'll talk soon. Take care.